Good morning, everybody. Dave, Tim, Dennis, thanks for coming. I really appreciate you taking the time to be here today. I thought that it was important for us as a group to get together and discuss some of the upcoming changes in Blue Cross and Blue Shield. As you know, the Blue Cross publication, The Record, of October 2014 indicates that they've got some major changes coming down the line. First and foremost, they're requiring that sleep testing facilities be accredited, which we are. Mid-Michigan Health is accredited as Joint Commission, and therefore we're all covered under that. So that's not a problem. The main difference is that they're now going to be requiring prior authorizations and leaning heavily towards home sleep testing. This could greatly affect our business. I know just here at Gratiot, 33% of our patient population does have a form of Blue Cross and Blue Shield. So if we were to lose all of that business, we're looking at around 300 patients a year that we won't be getting that we had in the past. So as you can tell, it's pretty significant possibilities, but there's ways around it. There's ways that we can deal with it, and that's going to involve educating the referring providers and their staff members, as well as ourselves. So I'm proposing that we get out there. We have a couple weeks left before February 1st. Get out there, start visiting the offices. Make sure that the physicians and their staff know exactly what's required and what services we can provide. They're going to have to start getting authorizations, which is going to be a process, and unless they know what information to provide, they're going to have a hard time with that. So if we can let them know exactly what they have to tell the insurance company, we should get decent results. So when you're getting an authorization, the insurance company's stock answer seems to be no. The office will call, ask for an authorization, and just be told no up front without any further investigation. I know this for a fact because I used to work in a family practice office, and I would try and get authorizations for patients to have different tests. I'm going to be honest with you, I didn't know what most of the testing involved, and so when the insurance told me no, I believed it. I thought, well, okay, it doesn't meet the requirement, I'm going to have to do something else. The problem is most of those patients probably did meet their requirement. You just have to know what information they're looking for and provide it to them. So is this going to affect everybody on Blue Cross? No. Federal employees, state of Michigan employees, prisoners covered under Blue Cross insurance, different programs are not going to fall under the Blue Cross requirements. So make sure that you get that information out, that not every Blue Cross member will have to have the prior authorization or the home sleep testing. In addition to that, as the slide indicates, some exclusions may apply. Basically, that's comorbidities. Anything else that the patient has going on that's documented in their record actually may disqualify them from having a home sleep test and qualify them for an in-lab study. Age, COPD, asthma, congestive heart failure, and then the suspicion of other disorders like limb movement disorders, if you suspect central sleep apnea, parasomnias, walking and talking in their sleep, or if you think maybe narcolepsy, then MSLT would be appropriate, and that can't be done at home. So those are just some things to consider. Make sure that you tell the offices, you know, if your patient has any of this stuff going on, they're probably going to be authorized for an in-lab study. So just make sure they know the key phrases, the key things to look for in the patient's record, and that they are giving that information to the insurance company. Teamwork. It's going to be all about teamwork. Teamwork between myself and you guys, teamwork between the office staff and us. We're going to work together by doing so, making sure that everybody gets the information, the tools they need. We'll be stronger. Our patients will be better served.
Introducing Pontoon.